You will probably not find it surprising that when we lose something, usually we grieve. We grieve the loss, and people don't always talk about that very much in the context of sexuality and cancer, but really if you lose a limb, you have to grieve it. If you lose a person, you have to grieve that person. So if you lose familiar sexual sensations and interactions, it's important to realize that that's happened and that there are painful feelings that can go along with it, and that those are normal and should be experienced, and that they get better over time. And it's important to realize that there's kind of a different way that we have to start relating to sexuality, although, as point number 4 says, you kind of don't want to disconnect from your old sexuality. Just because your sexuality is different now doesn't mean that it's not connected to what it was like before. And I always say to people, if you've been good lovers before, you can be good lovers in this context as well. You just have to figure out how to do it this time, and you kind of start as if you were 16 again, figuring out your sexuality. But this is all a part of grieving. You start by realizing that something has changed, start having the feelings about it, and then you start problem solving about how you're going to get back the good feeling that came from having a sexual relationship in this new context.
So then we need to also discuss, other aspects of vaginal health. I know that I had mentioned several times about vaginal lubrication and other things that can be done to help maintain that environment. So the first thing that can be done is just regular stimulation. So there's many ways that can be completed. I know that Daniela mentioned that some folks are a little adverse to masturbation or self-stimulation, but there's also other things out there that can help folks get that daily stimulation, vibrators and things like that. So definitely regular sexual stimulation. Even your partner can help participate and find good pleasurable spots for touching and stimulation. It doesn't actually have to be penetrative sex. Basically just looking for intimacy and arousal and areas that feel good to touch and stimulate. For vaginal health, if you're considering penetrative sex and you've had a vaginal reconstruction after cystectomy, before actually moving to something like that, there might need to be with perhaps different dilators, or sometimes even having the female be in a more dominant position so that they can control the amount of penetration and depth. We also probably need to use moisturizers, so KY, different types of lubrication, Replens. Usually water or silicone-based would be recommended. Glycerin is not recommended because it's a danger to men and women who are diabetic. The other thing that can be done to help maintain the vaginal environment, if it's feasible with gynecology approval, would be local or topical estrogen, which we'll talk about that again in a second. And then lastly, Kegel exercises or pelvic floor physical therapy. This can help strengthen the pelvic floor muscles, which can tighten up the vaginal canal, perhaps making some stretching a little bit more pleasurable. It can also help to deal with some of the scar tissue, stretch that area, and basically just condition that pelvic floor area that's seen so much trauma if we're talking about vaginal reconstruction and cystectomy. So that topical estrogen, one of the ways to do this is called Vagifem. So similar to perhaps like a tampon usage, there's an applicator where this medication is instilled inside the vaginal canal. But we wouldn't do this for folks that have an estrogen receptive cancer, like a uterine cancer or cervical cancer that has estrogen receptors. That could be dangerous for those patients. So that's why we always say with gynecology approval. But this type of topical estrogen can help with vaginal wall thickening, blood flow, lubrication. So it can definitely help with some of the side effects that you see in the vaginal area after having all these surgeries. Pictured here are some of the other devices that can be used. So we have things like dilators that can help stretch that vaginal area to perhaps make that area more receptive to a penetrative intercourse, so stretching that area out first. Vibrators can be used just for stimulation, and that can be done regularly. Sometimes with regular stimulation and touching that area, you can be more receptive and have greater stimulation, more pleasurable stimulation over time. And then lastly, there are pelvic floor exercisers and different devices that you can use to have a more definitive Kegel exercise, if you will, or strengthening that pelvic floor in different ways. It doesn't just have to be Kegel exercises. Ostomy clothing. So for some folks that have the urostomy site on the outside of the body and don't have the neobladder on the inside, one of those barriers to thinking about sex is just that ugly stoma, if you will, on the outside of the body. I've seen enough of these to know that they're really not ugly. They're just different. And so sometimes you wonder, how can I conceal this? Well, the internet is a beautiful thing, and there are many different agencies, and this is a link to some ostomy clothing, but they have different things out there that will help conceal the bag while looking sexy and feeling desirable, and just helping one feel a little bit more normal and covering that area up to make intimacy seem a little bit more possible. So they have, different underwear, undergarments, negligees, lots of different things out there and available for patients. This also includes things like bathing suits, because I know folks still want to be functional, and that includes going to the beach. So they have a lot of different options out there for patients nowadays. So this is a helpful site if people are ever interested in that. So part of the therapy can be vaginal reconstruction after removing all of these organs. So there's different ways this can be completed. I know I discussed using the remaining portions of the vaginal canal to help reconstruct, but you can also have skin flaps, skin grafts from different areas, chest to abdomen, but these would still need that vaginal lubrication, possible flushing of that area to keep it clean and maintained. And orgasms can occur, but like Daniela said, sometimes this just takes more stimulation and work and commitment to make that happen. But it is possible. It's just a little different.
These are just little cartoons to say that it's important for couples, if a person is partnered, to talk about what's going on. If somebody's dating, eventually there's going to have to be that conversation. It's important to accept each other and the fact that things are different now. And it's important to learn what our new interactions like, to learn what feels good, new techniques of pleasuring, and sort of deciding that it's important to accept that it's okay to learn. And then, people who feel awkward about sexual aids somehow have to learn that it's okay to use them, because mostly they improve blood flow, and blood flow is very good for sexual pleasure and for things like lubrication. So really, vibrators, for example, encourage blood flow, and that's very, very good for healing and for sexual pleasure.
So Daniela, could a good Harlequin romance book do the same thing for women, or a movie?
Yeah. Anything that turns you on is going to bring blood flow into the right places. Absolutely. So sometimes people choose to see a sex therapist, and so I just wanted to mention to you what happens in sex therapy. So first of all, one assesses sexual concerns and then sexual function of the person who's had cancer and the couple, so the partner as well. Any relationship factors or relationship history that might be contributing to any problems that people are having, and then then there's usually an individual's history taken to make sure that You can rule out any impacts of that person's history on current concerns, like if somebody had sexual trauma or something like that. Then it addresses the relationship, not just the sexual relationship. It introduces topics like communication, like spending time together, like various and sundry things that people sort of overlook as they getting older together and take a lot of things for granted. You have to kind of reassess them and readdress them. The outcomes that we're looking for in sex therapy is, of course, improved sexual function, and that means being competent at using sexual aids, better communication, better interactions, better self-esteem. And if people are depressed or anxious, then certainly help with that, because depression and anxiety have an impact on sexual pleasure. So the take-home points are that bladder cancer certainly brings about changes. They are a little bit similar to those brought about by aging, like loss of spontaneity and some sensitivity. But research shows that people can stay sexually active into their 90s. It's just the definition is changing of how sex is being experienced and done. Much of sexuality remains available, such as if there is a relationship and emotional intimacy, certainly sensuality and being able to be physically intimate, and for many people, the ability to have an orgasm also remains. It becomes more work because people need more stimulation as we age, or if people have had cancer treatment, such as bladder cancer, and the activities become more intentional, less spontaneous. The one skill that many couples, individuals have to learn is how to communicate about sex, because for many people, research has shown to us, sex can be done very, very well without ever saying a word. But once people start having these kinds of issues, communication becomes important. And I think that may be taking us towards the end. One last figure that I wanted to show you is how people can become very effective after bladder cancer treatment. Is that, if you are interested in sex, and that can come from an intention, not necessarily arousal, you can discuss with your partner about having sex, decide to do it, then arrange for a suitable time and space. At this time, a couple is usually pretty competent at using sexual aids, and so get them ready, and move through the process to orgasm. Usually when people have an orgasm, they're pretty pleased, and they can look back on having had to use sexual aids with more perspective and more acceptance. And afterwards, usually people feel very good. And I will say that some couples have actually improved their sexual relationships after having been treated for cancer, because they've had to work as a team together in an intimate way, and that's made their emotional intimacy and ultimately sexual intimacy stronger and more enduring.
Thank you for everyone joining us for this Patient Insight webinar. Please be sure that you take a few moments and complete the short survey and let us know what you really think about the program, about this particular topic, and everything else. We really do appreciate it. So thank you very much.